Thank you for joining us, colleagues. We are here with a fabulous occupational therapist, Joann McFee. She is the clinical director of Pediatric Therapy Solutions. I've worked with Joann for over 20 years, and she's taught me so much about the sensory motor platform. I thought it would be really beneficial in our course to hear directly from Joann regarding how sensory and motor skills relate to learning and behavior. So Joann, thank you so much for being here with us today.
Thank you for having me.
Do you want to tell our colleagues a little bit about your work?
Absolutely. So right now, I've been a pediatric occupational therapist for, like you said, over 20 years. And over the past 10 to 15 years, I really have specialized in working with kids with different learning disabilities. And so that is primarily the population that we see. And I work at a combination of settings. I do some work at some private day schools, so we can really support those kids with specific learning challenges. I work with a clinic that treats kids for dyslexia, and then we do some kids that just do some outside OT.
So you've taught me so much about sensory motor, and I've got another colleague, Shelley Manel, who's a pediatric physical therapist. She's taught me a lot as well in Canada. Can you tell us what are some important things that you think clinicians and teachers need to know about sensory motor skills?
I always kind of start with that when I think of kids, I think of that central nervous system pyramid, with cognitive learning being at the very tippy top. And at the very bottom are those basic sensory motor skills. And for all of those kids that are missing on those basic sensory motor skills, that you are seeing that don't know where their body's in space, or sensitive to different sounds, with those holes there, it's just going to make that academic learning piece harder. And so I always kind of sometimes, when you talk to educators that might not know as much about that, they're usually looking at some of these behaviors as how they're kind of disruptive to the classroom. But really, I try to remind them how these deficits are actually disruptive to that child's ability to learn. And so without sometimes addressing these underlying deficits, I mean, obviously children can learn, but it's going to be much, much harder. And that the demands, what they're going to have to do that's going to limit them eventually.
Can you tell us the landscape of like domains, vestibular, proprioceptive, the things that we need to be keeping front of mind?
So as OT, in the school setting, I mean, when you think of your sensory, vestibular is probably obviously the biggest one, because it controls so many other systems. It plays a big part in your primitive reflexes. It is just very centering. And when you think of vestibular information, vestibular input the effects last in your nervous system so much longer. So I feel like it's a very big one that I pay a lot of attention to, but obviously proprioceptive, knowing where you're at in space. We think a lot about visual in the school setting, because it is very visual. But visual processing is very complex, because there is obviously your response to visual stimuli, and then there is also that whole other visual perceptual processing, which is a very cognitive task. So that's kind of a little bit separate. And then tactile, I think, is another one that we don't pay that much attention to, because a lot of kids with your tactile sensitivities, it really is disruptive for them, in that, those are the kids that they're not able to pay attention to the teacher because of the tag in my shirt, the tag in my shirt, the tag in my shirt, because they're being drawn away from that. So those are really the core things that we're looking at in those core sensations. But then, not all kids have problems in that. I think that that's probably a little bit more severe, where you see some of that sensory defensiveness. I think it's more common, you will see the sensory regulation challenges, where they don't know how much to seek, or when they're responding to it, it's over exciting their body. But then just some of those are the next higher level of that, just like basic processing, but your body scheme and knowing where you're at in space, your awareness that you have two sides of the body, that laterality, motor planning, even just like postural security, things like, the kids can sit in their chairs. So those would be kind of that next level of sensory motor. And then the kind of next level we will usually focus on is more of those perceptual motor, like eye-hand coordination. We're talking about the visual spatial processing. A big one that I like to look at that I think a lot of OTs miss is that ocular motor control. That's another, it's another higher level as we're kind of building our way up, but very important in the school setting. So those are kind of the domains. When I'm doing an assessment, that's kind of where I'm starting. I'm looking at those basic, how you're responding to basic sensory inputs and challenges, and you're seeking or avoiding types of behaviors. Then I will look at more like those just body awareness, motor planning. That would be a part of the evaluation. And then that higher level we'll usually look at will be eye-hand coordination tasks and visual spatial processing and ocular motor. So I really like to look at all of those domains in a typical evaluation.
It's interesting because as you're speaking, I'm thinking of what I was taught as a psychologist 30 years ago, and we were taught about clumsy children. What we weren't taught was about dyspraxia, developmental coordination disorder. And I observe sometimes when I go into classrooms, I'll see children who are falling off their seats, and it's usually treated as behavioral. But what I learned from you is that it's how their central nervous system is not well integrated and their motor skills are not effective and efficient.
Yeah, absolutely. I mean, you will have the occasional kid that might do that or that is doing it for sensory seeking, but usually when a kid's falling out of their chair, it's because they are falling out of their chair and they're just that unaware of where they're at in space.
Now, you and I recently had a conversation that we hear from teachers all around the United States that children are coming into school with greater levels of deficits across the board: anxiety, speech deficits, occupational therapy challenges, motor challenges. Can you reflect, based on your 25 years of practice or more, what are you seeing that's different in these kids now?
Well, I feel like you have a lot more kids that this is a developmental or lack of exposure. Versus when I first started, I felt like a lot of the kids I worked with that had neurological challenges, or there was, a known diagnosis to why they were having these problems, where now I feel like these are kids that, kids don't do what kids used to do. They have, from infants, we don't put kids on the floor. They're learning those basic skills that you would be learning from birth to 3, and that sensory motor system they're not getting exposure and chance to develop those skills. So then when we are pushing them up to kindergarten, they have all of these holes because they've never had exposure to that, or they haven't had enough time to let that system develop. So I think that that's the biggest one. And there's lots of different things. I mean, as we have more technology, kids are having less movement, and to integrate the sensory motor systems, you have to have movement, and lack of movement can really cause some big holes in development.
So what are some things that we've got a lot of teachers participating and clinicians, what are things for them to look out for? And I don't mean diagnostically, I just mean so that we can fill those hills. I mean those holes, because clearly the more stimulation you have to practice those skills, the better. So I'm thinking that in our classrooms, and even I know in our clinic, there are actions we can take to help the system develop more. Do you have ideas about that?
One of the things I think teachers need to be better advocates for is making sure their kids are getting plenty of opportunities to move throughout the day. As teachers are being asked to teach more and more academically, we are cutting away from PE programs and recess, and those opportunities for kids to actually have some play within the school day. And just remembering that those things are kind of important. I know obviously you have many great classroom movement breaks. There are tons of things out there where teachers, I think, are starting to realize that, these kids, you'll start to see it in your class. There's some whole group activities that you can do and don't take a lot of space that can be really organizing and kind of help those kids understand that too. So I think just remembering movement throughout the day is pretty important. And sometimes you'll see, even depending on the level of age of kids, taking that time to work on movement. So, walking to class, we can add little exercises, as we're marching down the hall, maybe we'll cross march as we're walking down to music class, and activities like that can really just give some of those kids that exposure that need to practice those skills, and the other kids that have it developed, it's a nice little brain break. Giving those brains a break before we throw on more learning is always a good idea.
Yeah, and turning on the neurotransmitters that are going to help the kids learn more. So you said something that I hear a lot, and you just said that movement is organizing. And most teachers who aren't trained in motor cognition think the exact opposite. They're like, I just want them to stay seated because I don't want things to get hectic. Tell us how movement actually is organizing for the central nervous system.
Well, from an arousal level and thinking of how much you need a certain amount of sensory input to maintain arousal, and within your main forms of sensory input are going to be either vestibular or proprioceptive. And so those, when you have those kids that are fading, by giving that extra input, it's giving the nervous system what it needs so that it can actually attend. And yes, there are the kids that, as I said, movement, because of course I'm an OT, I'm sitting on a ball chair, right?
And I'm standing at a standing desk.
I've got my bike desk over there, so all of the different things that we do to keep our own systems aroused. But and kids need larger movement. Adults, I can take a piece of gum when I have go into curriculum night tomorrow night for my kids, and I'm going to be asked to sit there for 2 hours. That's how I will be alerting. That little movement will help with that. But those little types of things aren't usually as effective with younger kids. Older kids, the type of movement that they need and that can be organizing can be lower, but little things that you see. One of the things I loved at a class, you're talking about movement that's organizing, I didn't realize that I did, is I usually will do this when I'm paying attention. I'm applying deep pressure to myself to give me that little extra input, and it's increased. So that's when I'm really focusing on something. And I'm like, oh, yeah. I mean, we all seek out sensory tools throughout the day to help us regulate. And I think for me, even as a clinician and understanding all of the background behind it, nothing has really helps me myself other realizing how much I use it in my day-to-day life, and your own sensory needs and how important it is, and how certain things can really set you off. And I consider myself to have a pretty typical nervous system and be successful. And so then I think about kids that are developing, that are still growing this, and how important all of these little things are to them. I think so sometimes when I'm explaining things to teachers, I will use that too, is really thinking about how starting to be aware of your own sensory system and how the tools that you use and how it's organizing will really help you kind of understand better for your kids. And like I said, not every kid's the same, and not what makes it a little bit hard, but I think that is really sometimes the best place to start, and that's self-awareness piece.
So we're coming to a close here. I want to know, where do you think executive function skills fit with cognitive motor or sensory motor? What's your experience regarding that?
I think it goes back to the kids that are really struggling with their sensory motor systems. Cognitive executive functioning is right up there with academic. And if you've got all of those holes down there, it's going to be really hard. And also I think it pulls away, because your executive functioning skills are having to do things that your sensory motor system should be doing effortlessly. I think one of the easiest ones to explain, though it's not always as common, the sensory sensitivity, the kid that doesn't habituate to the tag in the shirt, and throughout the day is, there's a tag in your shirt, there's a tag in your shirt, a tag in your shirt. So then at an executive functioning level, you're having to tell your brain, I don't need to be paying attention to this, but that should have been at a cerebellar level, that your brain should have saying, oh, that tag's in your shirt, it's not harmful, we don't need to pay attention to it. So I think that, beyond the piece that you're going to have, like I said, you don't have all the supporting things in place for your executive function system to work. I think it also then has to work harder, because it's filling in the holes from some of those other things that aren't working correctly.
I love what you're saying about the fact that sometimes we have to exert conscious control over things that really should be mediated at the sensory level by the brain that is well hooked up, where the hubs are communicating effectively. I think that's so interesting. So as you and I both go to work, what are some takeaways? What do you really want teachers and clinicians to know about the motor system or the sensory system that we weren't taught in school?
Well, I think one of the things I always like to talk, teachers like to ask me about too, is because there are certain things that are so motor related.
Mhm.
Handwriting is a motor skill, and I think a lot of programs that are teach handwriting always look at it comes from an academic base, and really it's very motor based. So I think that's a really good area to take some stuff into. And I think the other motor skill that I really like teachers to pay more attention to is like the visual scanning and tracking piece.
Mhm.
Again, that is needs to almost some we don't use. It's a very finite skill that is not used until you learn to read, and you see so many kids that will struggle with that. And I think that I see this number increasing, and I personally think it has to do with the amount of technology and screen time that these kids are getting. So I think that sometimes those are two little areas that I always like to kind of just remind some teachers about. But that the how we use our vision and that ability to coordinate. Your kid that is clumsy, that is having a hard time holding a pencil, is probably having a hard time with those fine motor muscles of the eyes, and it's really going to affect everything that they're doing in the classroom. And I've even seen to imagine, like, if I'm reaching for this and I overshoot with my hand, if you're doing the same thing with your eyes, well, I'm supposed to be going up and looking at the board, and instead I overshoot, and then I'm looking at this thing over here, that's nice little display, and how that can affect attention and all of those other pieces. So that's one of the little areas that I always kind of like to keep teachers to keep an eye in the back of their mind, because those are times that you probably should be referring out when you
Mhm.
have a kid that's having those kinds of challenges.
Yeah, that was my final question. When do we refer out?
When you start, when you're making some accommodation and start trying some activities, and it doesn't seem to be enough, that's usually kind of when it starts, or you're not seeing those results. That's usually when I refer out, or something, like I said, like with those eye tracking pieces, that might be one child that has something that's so specific that you wouldn't have the time or the tools to deal with. That would be also kind of when I refer out. Is sometimes you'll just see a kid needs more needs than you can help throughout the day, or that their level of need is so high that we need to get in there and do some intense intervention to kind of close these gaps quickly, so that they don't. The goal is to not have them to have become behind academically because of their sensory motor system,
Mhm. Mhm.
because you can have that plenty of times too.
Oh, yeah. My colleagues, Chris Biani and Dr. Palmieri, they insist that a lot of learning disabilities are motor related, and Mary Mount Stephan too. They've written articles about this. The Europeans are way ahead of the Americans in terms of understanding the role of sensory motor and cognition. It's pretty fascinating. Like Israel and Poland, they've been doing motor interventions for academics for over 50 or 60 years.
Well, and the little bit that I do get to do, like whole class instruction and stuff like that, it is just so great to see. And I think the other thing I like to have teachers know, it doesn't take a lot to make big changes.
Mhm.
So, like I might go into a classroom 30 minutes every other week, and I might give them one or two things to practice. And, those kids might practice it 5 minutes a day,
Mhm.
but to see the progress that they make over time is really neat. So I think that's another thing to realize. It's like, it doesn't necessarily have to be, oh my gosh, one more thing on my plate I have to do. It can be, we're gonna do 5 minutes this morning and 5 minutes in the afternoon, and really start to see some big changes.
Well, we're here today with Joann McFee. She is the Clinical Director of Pediatric Therapy Solutions. I really appreciate you chatting with us. I think that the content that you've offered today will kind of add more glue to the motor activities we're going to be practicing. And we will be talking about doing things 5 minutes at a time. These brain priming activities are all 5 minutes at a time. So this really turned out great. I really appreciate your help.
No problem. Thanks for having me.
Okay, have a beautiful day.
Thanks, you too.